I'd like to talk to you briefly about some data challenges and opportunities, especially related to the healthcare sector. This is for an upcoming presentation at APRA International, and I'd like to just get some feedback, if I could, on what some of your data challenges and opportunities, especially the challenges part, might be. The first thing that comes to mind are rules and regulations. With HIPAA and everything else, it's difficult to, especially for grateful patients, to really collect that information that we need in order to fundraise. We have limited resources, especially in independent foundations. We don't necessarily have the technical expertise nor the money to do, complex screenings and other things that many organizations take for granted. We also have bureaucracies. Most of the health systems that we work in are extremely large. So they may be state, federal, or provincial, tied into bureaucracies that may include multiple hospitals. And so this ends up giving us, especially with data, technical environments that are often very complex, multiple systems. We may, for instance, be a foundation with multiple hospitals and have to collect information from all of them. We also have many complex businesses. For instance, we do lottery fundraising. We have gift shops, a lot of third-party events, market tables, and so again, it's a very complex data integration piece. Some of the other things, again, fundraising is often a small percent of the overall health system revenue stream. So because fundraising is smaller, we may not have the leverage that, for instance, some of the larger systems would be to get these data integration points in better sync and have the central IT people give us the resources we need in order to, integrate these pieces of information. We also have very complex relationships in terms of our data. For instance, we're affiliated with a university, and so we have a teaching piece here within the hospital. And so how do we coordinate that with not only the data, but the idea that grateful patients and alumni are quite different target markets, and what agreements do we have to have in place in order to, for instance, we don't necessarily want the university to acquire our grateful patients, and they don't necessarily want us to acquire their alumni, even though in some cases, because of the teaching hospital piece, those things are fairly integrated. We also have the idea of sort of catchment areas, so other societies and organizations such as the Cancer Society. Again, we may have patients that are in both organizations or associated with both organizations, or doctors, and so how do we differentiate between those? And again, I mentioned already the different levels of government involved. The last thing is the culture of philanthropy. It may not be developed or well implemented within the hospital, and so there's not sort of the data awareness that there would be in some other organizations that are more centralized, such as maybe a nonprofit cause organization, where data is the number one thing people focus on data. With hospitals too, we also have limited self-reporting by constituents and online communities. These communities are not as well identified, and they're not as prevalent as they are, again, with other organizations. We may have, constituent identification with hospital brands may be more challenging. If you're not feeling well and you're in the hospital, how associated are you with the brand? And it's not like, you may only be in there for a short time. So there's also that aspect of how do you then, want to give up your information in order to, be associated with the hospital. Also, the relationships with clinicians are complex because we have the ones doing research, we have the ones that are on-site, we have the ones that are on clinics, and so again, how do we integrate this data? In fact, the data with the clinicians with their own private clinics, the rules and regulations will be quite different than what applies to within our hospital system itself. And then the last thing really is the ages of our wealthiest prospects. And so these are people that typically are at a stage of life where they are more elderly, and with some of the complex health challenges or care that they may need, there's not the same level of engagement electronically that there might be with other organizations. Anyway, those are just some thoughts on data challenges. What I'm hoping is that you'll, think about these things pre the workshop, and maybe make some comments and everything on this video as to what some of your own data challenges are in healthcare that may not be represented here. Thanks very much for your time.